Hi, everyone. Thanks for joining us. I'm Jonathan Modi with OHA External Relations. I'm joined by Dr. Dean Seidlinger, Health Officer and State Epidemiologist, who will give our monthly update on COVID-19. A few reminders, please mute your audio and use the raise your hand function if you'd like to be added to the queue to ask a question. Please make sure to include your media affiliation so we know you are with the media. If you don't include your media affiliation, you won't be let in and you'll need to join the YouTube live stream where you won't be able to ask questions. We put a message in the chat that has a link to the live stream, by the way. If you're not with the media, we just ask you to please head over to that live stream. And again, yeah, the link is in the chat. We will be granting permission to record one by one. It does take a little time, so appreciate your patience after you ask us for permission to record. By the way, if you have audio issues and can't ask a question, feel free to drop it in the chat and I will ask it on your behalf. And also for our ASL partners on this call, I ask that our media partners please speak slowly when asking a question. I just realized I'm talking a little too fast myself, so I'm going to try to slow it down. And then one last bit of housekeeping, a reminder that a recording of this media availability is at the YouTube link that we shared in the chat and in the advisory for this event. So that live stream link will become the recording. So if you, for some reason, can't access that, please email phd.communications@oha.oregon.gov. And with that, I will let Dr. Seidlinger kick it off.
Thank you, Jonathan. Good afternoon. I'm Dr. Dean Seidlinger, Health Officer and State Epidemiologist with the Oregon Health Authority. Thank you for joining us. I want to start with a reminder that today's media briefing will be our last monthly or regular COVID-19 update for the media. We, of course, stand by to restart these briefings at regular intervals if needed, based on conditions with COVID and other seasonal respiratory viruses such as RSV and influenza. For now, we are closing out these regular briefings because we are confident that, thanks to increased immunity among people who have been vaccinated or previously had COVID-19, risk remains low, but risk is not non-existent. As with any infection, like influenza, whose constant but low-level presence we have come to live with, we anticipate that COVID-19 will be with us for the foreseeable future, perhaps forever. That means we will still see infections. We will still recommend wearing masks sometimes to protect people around us at higher risk of severe COVID outcomes. And some settings, such as healthcare facilities, may still have policies requiring that masks be worn. We will still need to stay up to date on COVID-19 vaccines, recommendations for which continue to evolve. Just this week, the FDA and CDC has simplified their recommendations and authorized an additional bivalent booster dose for some persons at higher risk of severe outcomes. And tragically, we will still see some deaths from COVID-19. But our outlook overall for COVID-19 continues to be good. To anyone who has been affected by COVID-19 or cared for or lost a loved one to the virus, my heart, my sorrow goes out to you. In Oregon and nationally, COVID-19 cases, deaths, and hospitalizations are trending downward, according to the latest Centers for Disease Control and Prevention data. On March 30th, we finally dropped below the 200 mark for hospitalizations in Oregon, which we have not seen since May of 2022. On Tuesday, April 18th, we had 172 individuals hospitalized with COVID-19 in Oregon, which was slightly higher than the week before, but still represents a steady downward trend from our recent hospitalization peak of 370 on November 29th, 2022. To put that number in perspective, our highest hospitalization count during the pandemic was 1,178, which occurred on September 1st, 2021, during the Delta surge. We've come a long way. The percentage of reported COVID-19 tests results that were positive has stayed relatively flat since the start of the year, with a slight jump occurring in late March. We expect this trend to continue, particularly as new subvariants continue to evolve and enter Oregon over the next several months. One variant we are keeping an eye on is XBB.1.16. Although we're not yet seeing this variant in our sequencing data, Dr. Peter Graven's team at Oregon Health and Science University is predicting that this variant, along with a variant called XBB.1.9, will likely cause a COVID-19 infection wave similar to the recent BA.4 and BA.5 and winter waves. Since this variant in particular appears to evade COVID-19 community or immunity in some areas. Even so, the wave is expected to peak by the end of June. Keep in mind, this is a long-term forecast, at least in COVID terms, and I expect to see adjustments in the numbers over the coming months as we learn more about infections from these variants. Because of our COVID-19 outlook and our winding down from the pandemic response, we are expecting a number of changes as the federal COVID-19 public health emergency ends on May 11th, and FEMA funding for some COVID-19 activities also wraps up. Since December of 2020 and throughout the pandemic, the federal government has provided COVID-19 vaccines and therapeutics to everyone in the US at no cost. With the ending of the federal public health emergency, COVID-19 vaccines will be shifting to commercialization, which means pharmaceutical companies will distribute and sell them like other vaccines. Therapeutics commercialization is product dependent with different timelines, and some are already available on the commercial market. This transition is likely to take place sometime in early fall 2023 for vaccines, and by the end of 2023 for therapeutics. It will not happen overnight. Right now, there are many unknowns regarding the commercialization process. For example, we don't know what the COVID-19 vaccine and therapeutic prices will be. OHA is working with other state agencies and the CDC to ensure everyone in Oregon will have continued equitable access to COVID-19 vaccines and therapeutics once commercialization takes place. We're developing a plan to ensure a smooth transition to commercialized COVID-19 vaccines, and will continue to provide partners with information and resources on COVID-19 vaccine commercialization as it becomes available. The CDC includes COVID-19 vaccinations on the routine child and adolescent vaccination schedules, so they will be covered by insurance. The federal government also recently announced an increased investment to provide vaccinations to those without insurance. Another result of the ending of the federal public health emergency is that OHA will no longer hold FEMA-funded community vaccination events. These events were at sites large and small, from the high-volume vaccination events at the former Multnomah Greyhound Park in Wood Village, the Expo Center in Portland, and Tektronix in Hillsborough, to smaller events at schools, farm and agricultural work sites, long-term care facilities, jails, and shelters. These sites were hugely efficient at administering the many types of vaccine doses that were offered over the course of the pandemic throughout 2021 and 2022, including the monovalent primary and booster doses and the bivalent booster doses that became available last fall. Some events even offered the influenza and mpox vaccines, as well as COVID testing. In total, more than 340,000 vaccine doses were administered at more than 6,300 vaccination events. I want to thank OHA's field operations team, our local public health and community partners, federal and tribal partners, and everyone who made these events such a success during this critical time. Access to My Electronic Vaccine Card at myelectronicvaccinecard.oregon.gov will end May 11th when the system is decommissioned and archived. People can still use the e-card through the service as proof of their COVID-19 vaccine indefinitely, but they should add any boosters to the card before May 11th. After that time, they will not be able to update their information, nor will people be able to set up new accounts. There are other ways to prove COVID-19 vaccination, including showing your original white record card from the CDC or a photo of the card, or sharing your immunization record from your healthcare provider or from OHA's Alert Immunization Information System. Lessons learned in developing My Electronic Vaccine Card will inform future efforts to provide easy access to personal vaccination records, and the system itself can be used in future public health emergencies. Today, a total of 95,005 COVID vaccination records have been successfully viewed through the My Electronic Vaccine Card since April 21st, 2022, with 24,328 of those done by repeat requests for an updated record. As many of you are aware, on Tuesday, the U.S. Food and Drug Administration once again amended the emergency use authorization of the Moderna and Pfizer COVID-19 bivalent vaccines. Only bivalent vaccines are now authorized, both for the primary series and for boosters. And FDA authorized a second bivalent booster for persons 65 years of age and older, and for people 6 and older with certain immunocompromising conditions. Yesterday, CDC's Advisory Committee on Immunization Practice discussed simplified recommendations for these vaccines, and these recommendations were affirmed by the CDC. Stay tuned for additional recommendations, including whether regular boosters will be needed. We recommend anyone who is now eligible to get the bivalent booster to do so as soon as they can. They can get the booster through their healthcare provider, a county public health vaccine clinic, federally qualified health centers, and local pharmacies. And as of today, 78.3% of people of all ages in Oregon have received at least one dose of one of the original monovalent COVID-19 vaccines. 70.3% have completed a primary vaccination series. Unfortunately, only 22.2% have received a bivalent booster shot. That's less than 1 in 4. Finally, I want to share a quick update on behalf of my colleagues at the Health Systems Division on the Oregon Health Plan coverage as the public health emergency winds down. When the pandemic hit, the federal government extended benefits to states that kept people on the Oregon Health Plan, Oregon's Medicaid system. As the public health emergency winds down, Oregon continues to move the dial on equity work and remains laser focused on achieving health and service equity. We can only do this by trying to keep as many people as possible connected to benefits and covered by a health plan. Redetermination for Oregon Health Plan coverage began April 1st, and depending on the date they are scheduled for renewal, Oregon Health Plan members will receive a renewal notice from the Oregon Health Authority and Oregon Department of Human Services between now and January of 2024. As our media partners, you can help us by reminding people to keep their mailing address, phone number, and email address current. Keep your mailing address, phone number, and email address current to ensure that you receive vital information about your benefits. Oregonians should be watching for letters about their benefits from the state's one customer service center and our state agencies, OHA and ODHS. The renewal letters will tell them what to do. Not everyone will get their letters at the same time, but for more information and to keep coverage, people can visit keepcovered.oregon.gov. Now that Oregon's public health emergency order has expired, the last of the state mask requirements has lifted, and the federal public health emergency is coming to an end, we can now return to those activities and functions we all enjoyed before the pandemic began in early 2020. But some may continue to make changes to protect their health and the health of those around them. But we also have a keen understanding of the devastating effect an organism like COVID-19 can have on individuals and families, on tribal communities and communities of color, on our state, our country, and our world. We know our lives will never be the same, and that COVID-19 will likely always be with us. That's why it will be important for everyone to stay prepared by knowing your risk of severe illness and reducing that risk by staying up to date on vaccinations. Make a plan for protecting yourself and others if you get sick, and take action by getting tested if you have symptoms, contacting your healthcare provider if you test positive, and protecting others by wearing a mask. Thank you to all of my fellow Oregonians who continue to take these important steps. I want to thank all of you, our media partners, for attending these briefings over the last 3 years and sharing what you learn with your readers, your listeners, and your viewers. You serve a critical function in the dissemination of important life-saving information that helps people in Oregon keep themselves, their families, their neighbors, and their whole community safe. With that, I'm happy to take your questions.
Thank you, Dr. Seidlinger. Just a reminder to please use your raise your hand function if you'd like to be added to the queue to ask a question, and make sure to mute your audio if you're not asking a question. And just one quick reminder for our ASL partners to please speak slowly when asking a question. Okay, looks like our first question is from Lisa Balick with Coin TV. Go ahead, Lisa.
Yeah, hi, Dr. Seidlinger. When it comes to these variants, especially that one Arcturus right now, that's really starting in, you reeled off a whole bunch of different ones with the numbers and the letters. So I'm just trying to find out, when it comes to that particular one, is that one that there's a heightened level of concern here in June when you mentioned a wave?
Thank you, Lisa, for that question. XBB.1.16 is sometimes referred to as Arcturus. So that is one variant that we're seeing causing increased infections right now in India and some other parts of the world. We know that that variant has been detected and reported in the United States, though not yet in Oregon. As with many of the other Omicron subvariants, it is very easily transmitted from person to person. So we expect to see, once that infection, that variant is identified in the community, that it may spread rather quickly. Individuals who've recently recovered from infection within the last couple of months will likely still have some protection. And individuals who've recently been received their updated vaccines will also have some protection. Folks who've had that recovery or who are up to date with their vaccines should be protected even from this variant, being hospitalized and dying from this variant. This variant does show some characteristics that may mean it may be able to elude some of our immunity. We've seen that in many other variants, including many of the Omicron subvariants, that ability to elude our immunity is seen in the lab and is seen in characteristics of the virus. But in the real world, our current levels of protection with vaccinations and recent recovery do seem to offer a fairly high level of protection from severe disease and death, even with these variants that are just now emerging long after the vaccines were developed.
Thanks, Dr. Seidlinger. And thanks, Lisa. Our next question is from Morgan at KATU. Go ahead, Morgan.
Hey there. Yeah, so I have it's not really a specific question. I just kind of wanted to ask in general about the toll that the pandemic has had on the mental health of kids and teens, and just our minors in the state. And if you could just tell us a little bit about what we can do to help kids who are experiencing issues with mental health, and how the pandemic has exacerbated that.
Thank you. During these regular briefings, I've focused on the direct toll of COVID-19. The Oregonians who passed away, who are no longer with us, that number is over 9,000, approaching 10,000 to date. So we have those families who are mourning and grieving the loss of loved ones. Many individuals who were seriously ill, hospitalized, and continue to suffer from symptoms long after their acute infection. Those tolls are certainly real. But certainly there have been many secondary impacts from COVID-19 itself, causing these long-term symptoms, to our response to COVID-19 and limiting the spread. Children have been especially impacted with disruptions in in-person education occurring, the subsequent separation from support systems and some of the caring adults in schools that they would normally see every day. We know that going into the pandemic, we certainly were seeing increased levels of mental health needs, and as well as behavioral health needs, substance use disorders amongst children, adolescents, and young adults. That has continued during the pandemic and in many cases was exacerbated by some aspects of the pandemic. The arrival of fentanyl and other more potent drugs on the scene has also come into play there. Our schools, our Oregon Department of Education, our K-12 schools are using new investments from our federal government as well as from Oregon that were authorized several years ago to help build more social and emotional supports, access to services through schools for kids who need it, for kids who've been suffering from mental health diagnoses. We're also working, as we know, our behavioral health system in general, accessing services, accessing care and the supports that people need is needed for adults in Oregon as well as for children. And so we look forward to seeing those investments on the ground to help kids and families be supported through these increased levels of diagnosis. We know that the pandemic certainly has disrupted much of our education system, but we've set as our North Star the goal of maintaining safe in-person instruction for students as we move forward, to ensure that those students have access to their teachers in school, that they have access to the other services, the social and emotional supports in schools, for some accessing healthcare through our school-based health centers in schools. And we see that system really becoming more robust as we move through and these investments are made. But more needs to be done. We can't blame this all on the pandemic, but certainly that was one of the exacerbating factors, along with multiple other outside factors, the change in social media response, the change in our substance use landscape with fentanyl and other drugs coming on the scene. And so really, it's an all hands on deck approach how we can best support kids through this current crisis.
Thank you.
Thanks, Morgan. Next question is from Billy with KBAL. Go ahead, Billy.
Hi, Dr. Seidlinger. Just kind of a quick question related to something you mentioned about this expected June wave and this new round of boosters that the CDC announced yesterday. Could you kind of just touch on this June wave that you were mentioning? I apologize. It's a bit of a clarifying question about what this June wave is.
Certainly. I appreciate the partnership with Dr. Graven and Oregon Health and Science University, who's been doing Oregon-specific forecasting for us here in the state. What we see is that forecast goes out a fairly long way and predicts the estimate of COVID-19 burden on hospitals in Oregon through June. It sees a relatively flat period of COVID-19 hospitalizations through May with an increase into June that could be higher than some more recent Omicron subvariant surges. There's a lot of uncertainty as we go out this far. And some of the assumptions in there are looking at how some new variants like XBB.1.16 and XBB.1.9 might behave here in Oregon. Certainly, I would expect some changes in that forecast as we get closer and learn more about these variants. But for the short term, through May at least, Dr. Graven's forecast and the ensemble forecast, the multiple academic partners who do state-specific forecasts at the CDC, project a relative flattening of cases. But in June, we do expect to potentially see an increase in cases based on these new variants. And that's why it's important that people look at their vaccination records now and use this time to be up to date with the most recommended boosters. This is especially important for those over 65 and those people with immunocompromising conditions over 6. Take the time now to get that additional second booster so that they will have protection if we see this peak, this wave come true in June.
Okay, thanks, Billy. Next question is from Gary Warner with EO Media. Go ahead, Gary.
Hi, Dr. Seidlinger. Wanted to ask if you're seeing anything out there around the world in terms of anything other than an Omicron variant for COVID-19 to be concerned about, and also the bird flu and concerns about a possible crossover there.
Thank you, Gary. Certainly what we've seen over most of the last year is that as new variants of COVID-19 have come up, it's the Omicron subvariants that really have taken hold in communities. That's because these variants are highly contagious and it's easy to spread from one person to another. So even individuals who recently recovered or exposed to someone with one of these infections may get sick if they're not wearing a mask and taking other steps to protect themselves. We do occasionally see some other variants that have emerged, but they're not taking hold the way many of these Omicron subvariants have. While they're very contagious, they overall have not been causing more severe disease in individuals who get sick. And our vaccinations that we currently have, as well as recovery from recent infection, tend to provide good support against serious disease resulting in hospitalizations and deaths. So that's really what we've seen as a pattern over the last year and that we're continuing to see. I don't see other variants out there right now, but that doesn't mean we won't in the near future. As far as highly pathogenic avian influenza, we continue to monitor that situation, and it's had devastating impacts amongst bird populations, both wild birds as well as birds that are being raised for food. We've seen transmission of the highly pathogenic avian influenza into several mammalian species, and even the transmission to several humans, and seen some human cases. But we're not seeing widespread transmission of these influenza viruses from person to person or from other animals to humans. And so we continue to keep an eye on that, monitor that just in Oregon as well as other states and around the world. With that, we also always look for other emerging viruses, whether it's a virus that we've known about for decades, like Mpox, that saw a surge last summer and continues to show sporadic cases here in Oregon and other states as we move into our towards our second year of dealing with this virus. We're also on the lookout and helping to amplify our CDC messages to healthcare providers about Marburg virus, which is occurring in Africa, and about specific questions that providers should ask on someone who may have returned with symptoms from one of those areas, and questions they should ask about travel history. So public health is always looking for unusual diseases that may be occurring in humans, unusual patterns of diseases, diseases that are occurring in new ways. And when we see those, and when we see a threat to the broader public, we're committed to sharing that information with our healthcare providers, with the general public, so they know what steps they can do to protect themselves and to care for their patients.
I was just going to follow back. I want to clarify, have you seen bird virus cases in humans in Oregon?
I don't believe we've seen human cases here in Oregon. I can clarify to see if that's the case. I know we've seen a handful of those human highly pathogenic avian influenza cases across the country, but the majority of our cases have been in birds, and we've seen some other species, mammalian species, that have been identified with avian influenza in the past months.
Thank you.
Thanks, Gary. Lisa Balick with Coin TV has a follow-up question. Fedor will get to your question next. Go ahead, Lisa.
Yeah, thanks. Just two quick follow-ups, Dr. Seidlinger. One, I just wanted to follow up. Are you expecting any kind of a surge? Like, have you been meeting with the hospital association to say, hey, you need to probably gear up for June? And the other question is, with folks who are considering getting that second booster, I know you always say just get it when it's available, meaning now, but they're looking at in the fall, if they get it now, are they going to be protected in the fall? How likely is it that there'll be yet another booster available then when they're inside? There's a lot of concern of people wanting it sort of to get the best bang for their buck with that. So first the hospitals and then the booster.
Thank you, Lisa. Our my public health colleagues, both here at the state and our public health preparedness and response at the local level and tribal level, have regular meetings with our regional hospital partners and then some local meetings that happen to discuss the current situation and what we might expect. I think we share the forecast that we see from Dr. Craven. We share the most current data that's updated weekly on our website with them, so they can know what to prepare for. I think we have to interpret the peak and the height of the peak in June in Dr. Craven's forecast with some caution, because it is fairly far out. But certainly I think we need to be prepared for changes in COVID-19, potentially causing an increased number of folks seeking care, at the same time needing hospital beds. And we've learned a lot, and our system ultimately is stronger for the past 3 years of working together. Yes, our healthcare providers, those on the front line in hospitals and local public health here at the state and our federal partners are tired. There's been a lot of, period of being on, seeing tragedies in front of them with people dying, working extra hours, working in conditions they're not used to. But the system, hasn't broken. We've seen, we've had to add resources to the system. We've had to provide care in different ways, but partners have come together, have provided the best care we can, even during the highest peaks to the Oregonians in front of them. And I anticipate if we see an increase in cases in June, we'll see that again. As for the second question, I need you to repeat it, Lisa. I'm sorry. I talked too long.
Oh, there we go. No, that's all right.
Boosters, yes, and timing.
Yeah, just the timing. You guys always say, hey, get it when you can get it, so go get it now. But there's a lot of folks who say, well, I'm more concerned about what will happen in the fall when I go back inside. And that's really when I'd like to be able to have the strongest protection. And without any kind of definitive answer yet as to whether or not there will be any kind of a additional booster offered in the fall, folks are trying to figure out what to do.
Thank you. The recommendations for a second bivalent booster dose to be considered for individuals 65 or older, or those people with immunocompromising conditions 6 and older, was made because the data shows that there's some decreasing protection from severe disease and hospitalization in those patients. That's why our federal partners and OHA recommend that if it's been 4 months or more since your first bivalent booster, that you consider receiving a second bivalent booster if you're 65 or older, or 6 years of age or older. While I can't fully predict the future, I anticipate that we'll be recommending a booster in the fall, not only for that group that's at higher risk, but likely for a broader group and perhaps everyone, similar to what we do in influenza. So I don't think getting that second bivalent booster dose now will preclude individuals who are at highest risk from getting an additional booster dose in the fall. But we await, the data that shows how this protection is lasting and what vaccine products are available for us in the fall. But my recommendation to my family members who fall into that category, to friends who ask me, is that if you fall into one of those higher risk categories and it's been 4 months since your last bivalent booster dose, I would suggest you get that second bivalent booster dose now to offer you protection as we go through the summer, and know that we will likely be recommending an additional booster dose for you in the fall to continue to provide you protection.
All right, thanks, Lisa. Next question is from Fedor at the Oregonian. Go ahead, Fedor.
Hey, Dr. Seidlinger. So you mentioned several times that we should be looking at these forecasts with some caution. I wanted to ask you to expand on that again, in the context of, if we recall the Kraken subvariant forecasts that predicted quite a surge, that in my understanding, and correct me if I'm wrong, didn't quite materialize as was warned. So how do the forecasts now compare in their reliability to the forecasts or the predictions and warnings about the Kraken subvariant back then? And second, could you please give us an update on Mpox? OHA doesn't appear to have updated the monthly update on that.
Let me say that a few things in forecasting add more to uncertainty. The longer we look out into the future, and this most recent OHSU forecast looks a little further out, the harder it is to predict what's going to happen because we do it based on the conditions we're seeing now and where we anticipate we might be with hospitalized patients with COVID-19 in the future. Also, kind of every country and even communities within that country are seeing very different patterns. It used to be that we could see what happened in some Asian countries who were hit first by some of the by COVID-19. We would see what happened there. We would see a similar pattern in European countries, and typically some states in the Northeast and East Coast would see a similar pattern. And we would know that was coming to the West Coast. The period of time shortened between when we would see that initial pattern and when it would arrive here. But now, with every country kind of having different levels of protection from vaccination, having done their vaccine campaigns a little differently and seeing different levels of booster uptake, with different countries having been impacted harder or less hard by recent waves and seeing different levels of protection from recent recovery, it's harder to make those kind of one-on-one predictions. But certainly the Omicron subvariants that are included in OHSU's forecast do appear to be highly contagious, and at least in some countries such as India, do appear to be causing some more severe disease right now. So we'll continue to watch that, continue to see how those variants are behaving in other states, continue to see when that variant XBB.1.16 is identified in Oregon and how quickly it spreads to help refine that forecast. So I do anticipate some changes. But forecasting in general has become a little more difficult because there are many more variables to consider, but it's one tool we use to try and look at where we may be in the near future. As for Mpox, I think the latest update on our Mpox website was made on April 19th, I believe. On April 19th, we've had 279 cases of Mpox identified here in Oregon, 277 of those among adults, with 2 amongst pediatric cases. We're not posting as frequent updates on some of the extensive demographic information because with those multiple data points, it can be easier to identify or potentially identify folks from that small number of cases. But we're really only seeing a handful of cases in recent weeks that are being reported into Oregon. But we remain prepared, have deployed vaccine to many providers and local public health partners, and we'll be working with community partners to try and do some targeted specific vaccine events as we move into the spring and summer in advance of what's traditionally kind of pride festivals and other gatherings that seem to have spread this disease more quickly last summer.
Thank you. Thanks for that. But if not to belabor the point, but can you speak specifically to what OHA has learned from the experience of the warnings about the XBB.1.5? I believe that's the Kraken one, and the wave that followed that did not, in my understanding, materialize quite to the extent that was forecasted, and what OHA has learned from that experience regarding this current XBB subvariant that could be on the horizon.
I think I will say that there is, uncertainty in our models and our forecasts. These aren't predictions of the future. This isn't a fortune teller with a crystal ball that things will come true. And I think what we've learned is that there are multiple things to take into account. The level of vaccination in communities, when those vaccinations occurred, how much was a community impacted by recent infections during recent peaks, and what period of time has lagged between that recovery and now? How are people interacting? Is it a time when people are spending more time indoors or out? Are people wearing masks regularly in situations or not? All of these things, come into play as we try to forecast and look out into the future. As we look out further, it gets harder and harder to see that horizon. It becomes, a little fuzzier. And so I do expect that, similar to other forecasts that you mentioned during peaks where we're seeing new variants, that there will be some adjustment, whether up or down. I hope down as we go forward, that we'll see that. But right now, this is one tool we have to look forward to. I think that this is likely a worst case scenario, and we'll see some refinement in those as we go forward. But we'll continue to look at that data as well as the ensemble forecasts from our academic partners that are compiled by the CDC, as well as how these newer variants are impacting other countries, as we message to individuals. What I will say now is I don't see anything changing our recommendation that everyone should look at their vaccine record right now and be up to date with their most recent recommendations for vaccines and boosters. That if you're at higher risk for severe disease, so you're an older Oregonian, you have an underlying condition like lung disease that puts you at higher risk for complications from COVID, or you're immunocompromised, or you live with or care for someone in those groups, you may be taking additional precautions right now. You may still be wearing masks in many indoor settings. You may be wearing a mask when you go to healthcare providers, or asking healthcare providers to wear a mask when they see you, and that's okay. Individuals should be making those decisions based on their own individual and their family's risks. And I don't think my recommendations are going to change to be up to date and to make those individual decisions, regardless of whether this peak goes up or down in the updated forecasts that will be coming out in the coming months.
Okay, thank you. Thanks so much.
Thanks, Fedor. We have a follow-up question from Gary Warner. Go ahead, Gary.
Yeah, Dr. Seidlinger, as somebody who's been on this ride with you since pretty much near the beginning, is there any concern you have about sort of the unspooling rapidly of the emergency situations, the funding, the reports, the research? Some of the members of Congress in the House are suggesting that the money that has gone out to the states that hasn't been spent on COVID-19 should be clawed back. It took so long to build up this response that we have now. Some folks would be concerned that we're moving kind of rapidly in the other direction. And will we be ready to rebound? Will we have to rebuild the whole system if something comes back?
Thank you. So, in public health, myself included, we're often, part of our job is to look forward and try to look for what are the potential next threats and how might they impact, to help communities be prepared, whether it's our healthcare partners, individuals, or other institutions, so that if something happens, whether it's a communicable disease like COVID-19, an environmental exposure like happened in the Midwest following train derailments, the impacts of climate change and increased wildfires, to help be prepared to respond in those situations. I think we've learned a lot during COVID-19, and those lessons will carry us forward. I think, we've worked together in ways that we haven't over the last 3+ years, because usually our response to a communicable disease outbreak or epidemic or pandemic doesn't last as long as it has here. We've received tremendous investment from our federal partners, from our federal partners, as well as the state legislature signing into public health modernization investments over the last couple of terms that have helped to strengthen our system. But the other side is, my public health colleagues at the state, local, federal, and tribal level have been at this for 3+ years, as have all of you, at battling this disease, and we're tired as our healthcare partners. We've lost some members of the workforce who've left because of that, but we've brought a lot of new individuals into the workforce. I think we need to continue to invest the resources we have. While many resources are going away from the federal government, like the FEMA reimbursement, other resources through the Centers for Disease Control and Prevention and other federal dollars continue to come into the public health system here in Oregon. We continue to use investments in public health modernization that have come from previous legislative action signed in by previous governors, and are awaiting the current budget to go through for those investments to come to us at the state, local, and tribal level, as well as our community partners. So I think, there are some positives here. The way we've worked together, the way we've been able to rely on each other, and the way we've invested the dollars that are real positives. Yes, a decrease in that level of investment does decrease some of the ability for us to respond immediately, but I believe we'll be able to surge up and to utilize our partners on the ground across multiple organizations to respond should the need arise. We may not be as nimble as we were, a few months into this because we're all tired, but certainly we've learned a lot of lessons. Our investments are not going back to what they were before the pandemic. But I think this is uncovered during this response, the real, I think, value of public health that often operates very silently in the background. We try to keep people healthy and not to be noticed. The system itself was likely underinvested for years, and that's why we're grateful to our state legislative and gubernatorial partners who've made the public health modernization investments they have since before the pandemic and continue to make those investments. For our federal partners and our partners at the Centers for Disease Control and Prevention, who continue to try and provide us the flexibility and resources we need to respond not just to COVID-19, but to multiple responses, whether it be an infectious disease or an environmental hazard. But yes, I think we'll remain on edge. We'll remain on the lookout for new diseases. We will continue to work with you, our media partners, to get the word out to individuals about actions they can take and actions that they should be taking on a regular basis or need to take acutely because something new is upon us.
Thank you, Gary. Well, it looks like that's all the questions for now. I want to just give one last call out for any questions, any other questions you might have. Again, please use the raise your hand function if you'd like to be, if you'd like to ask a question. Fedor, is that a follow-up from you?
That's right. That's right.
Okay. Yeah, go ahead.
Real quick. So this is the last regular monthly briefing. And what circumstances would you expect to do another one?
Thanks. I think if the situation rapidly changes, so we're seeing a variant or a disease behave in ways that it hasn't before. We're seeing influenza or RSV come onto the scene with COVID, not during the predicted time where we expect those to start coming in the fall. As we wind through some of the changes from the end of the public health emergency declaration at the federal level, and as we look at our current reporting practices and changes we might make, we may convene everyone so that we can talk through those and answer questions about those so that you can help us provide the best information to the public. So it's not one thing, but multiple things. And we'll continue to answer questions on a regular basis as they come in and continue to post the information we have that shows the spread of COVID-19 and the impact on our healthcare system and Oregonians on a regular basis.
Okay, well, enjoy the break from these.
There's certainly not a shortage of things for public health to do and to respond to.
Yes, indeed. Thanks, Fedor. Appreciate it.
Thank you.
Okay, well, unless there are any other questions, I think we'll go ahead and close out this this last monthly COVID-19 media briefing. And I will kick it back over to Dr. Seidlinger to close us out.
Thank you. Thank you to all my media partners for helping us to get the word out and for asking us questions and clarifying questions about our response and the potential impacts of COVID-19 across Oregon. I think in Oregon, we need to be proud of the actions we took and the response we had. We know that in looking at comparison data of deaths from COVID-19, Oregon did relatively well compared to other states. And this isn't because the governor issued emergency orders or because public health made certain recommendations or because our healthcare providers, worked longer hours and provided care to individuals or because individuals got vaccinated and boosted or wore masks. It's not any of those alone, it's all of those together. And I think we need to be proud. And I want to thank all the Oregonians whose lives have changed and who changed their lives in responding to COVID-19. The death toll, while it's approaching 10,000 here in Oregon, could have been much higher. Yes, there have been many other impacts from COVID-19 to individuals recovering from long COVID, individuals whose economic livelihoods were changed during the periods of shutdown. Students whose education in person was interrupted for a period of time are now back in schools, and we're seeing, mental health impacts in those students, not solely due to the pandemic and our response, but multiple other issues as well. So there have been many people who've been impacted and continue to be impacted, but I think we can be proud of the way Oregonians have come together our healthcare providers providing amazing care, my public health colleagues across federal, tribal, state, and community-based organizations, as well as here at OHA, that have really stepped up and tried to provide the best communication and data out to individuals and gotten Oregonians vaccinated to the tune of almost 80% receiving 1 dose. I think, my challenge for Oregonians is that for those of you who have not yet received an updated COVID booster, a bivalent booster, please get one. Only 1 in 4 Oregonians have gotten that bivalent booster, and many more are eligible. If you have that in place now, that will provide you protection as we go into the summer and prepare you for the fall when we expect potentially another booster. But be proud of our actions, and we'll come back together as needed to talk about COVID-19 and other public health emergencies and other public health issues, and ways that we can work together to keep each other healthy.
Thanks, Dr. Seidlinger. And thanks again to our media partners for joining us for this and for all the monthly COVID-19 media briefings. As always, if you have any follow-up questions, please email us at phd.communications@oha.oregon.gov. And just a reminder that the recording of this media briefing will be at the YouTube link that was in our advisory. With that, have a great